I'll start with Dr. Youven, who will do the presentation first. But Dr. Youven, what are we expecting today, quickly, for all the participants today?
So, hi everyone, I'm Dr. Youven from Mauritius, medical practitioner, specialized in sports medicine. Today, I will talk about the current situation in Mauritius, how it's going, the different statistics, and how we are going in Mauritius for the vaccination, how it's going, who can do the vaccination, who can't do the vaccination, the side effects, and so on. So my presentation will be mostly on the current situation of Mauritius, and from this we'll be able to develop together how it's going.
Okay, thank you. We move on to Dr. Umesh. Thank you for connecting from the UK and for giving back your invaluable time. Quickly, what are you expecting today?
I was a pediatrician. My passion is patient safety and mental health and depression and how to, come out of these depressions. And that's what. And I'm here to answer any questions about mental health and why mental health is going to increase with COVID and how much it costs and how to be happy in life. And I'll be happy to answer any question about COVID as well.
Wow, awesome. How to be happy in life. Look forward for that one, Dr. Umesh.
Very simple, very simple. Happy life, happy wife, happy husband.
Whoa, okay, I should remember that one. Dr. Vinod, happy wife, happy husband, happy life. What are we expecting today?
Hi, I'm Vinod Gadiyar. I work in Manchester as a consultant in anesthetics and pain management. I've been involved in care of COVID patients in the intensive care. So what I'm expecting is to have a very good discussion about what are the causes of people not believing in the vaccine and how vaccination is important to get out of this pandemic. So I'm here to talk about this, and I want to make sure that people understand that this is a very, very important issue for us to get rid of this pandemic.
All right, thank you. And we move to Smruti. Smruti, you're on mute. If you can unmute yourself. And Smruti, if some of you don't know Smruti, Smruti is Shilpa Nahabu's sister and Uncle Jadav's daughter. She's based in UK, Uncle Jadav, Sanansing Jadav's daughter. So Jadav, Uncle Jadav's daughter. Smruti, thank you for being here and thank you for bringing everybody together for this webinar. What are you expecting from you, Smruti, today? A few words.
In few words, obviously all the panelists are doctors and I'm expecting a meaty subject on COVID, which is the current subject. And I'm sure we can help and save lots of lives through these doctors and their knowledge. Thank you so much.
Okay, thank you much indeed. And in fact, I was saying, I look like the doctor in this whole panel. So I take that as a credit and let's move on swiftly. So I'm just gonna, if everybody can switch off their video, I'm just gonna do a quick introduction for a few minutes and then we'll get back to, and someone is saying, Anil, or you're a doctor. Thank you very much indeed, that's Dr. Umesh. So if you can switch off your video quickly, guys, and then I'm just gonna introduce the webinar officially before we kick off. All right, so here we go. And I'm just gonna start from beginning. Just make sure I've got the video as well on, right, and just making sure we've got the voice. All right, good evening everyone from Mauritius, and thank you for being for this webinar CPD talk on increasing awareness of COVID-19, and it's all about the awareness today by international practitioners and our very own Dr. Youven from Mauritius. The presenter today is Dr. Umesh Prabhu from the UK, Dr. Youven Naiken Gopalla from the Mauritius. We've got Dr. Vinod Gadiyar from the UK, and we've got the very own Smruti Jadav, who is going to be our moderator today. Quick agenda, we'll have a quick introduction as always, quick survey. Dr. Youven will do a presentation for us. He needs to leave in an hour, so he'll do the presentation. We'll have a quick Q&A with him, and then we'll have a presentation from Dr. Vinod, Dr. Umesh, and then panel discussion. So it's going to be a jam-packed webinar today on COVID-19. So quick housekeeping, Gogan, thank you to everyone, and also to Dr. Youven, Dr. Vinod, Dr. Umesh, Smruti, for giving back. Thanks a million for all your time today. Just quickly, I am in construction, so COVID is very much relevant to all of us because we use, we work in mass, if you like, with 200-300 people on site. So it's very important. So love construction, love learning, love sharing, love people, passionate about giving back, and almost 19 years now in the construction industry. Of course, I'm humble, honored, and privileged to have all of you today watching us, as well as all the speakers today with us. So I'm going to start with a Menti. It'd be good to put some context to the webinar today. So as always, if you can just go to menti.com, I'm going to try that as well. And if you can just go to menti.com and type in 9874 0605. The speaker can do that as well, and the panelists. 9874 0605. And I'm just going to share the screen now with all of you. Right, and be good to know where you are. Even in Mauritius, we know the area you are in, the zone of rouge, comme we'll say, or the red zone, if you like. So if you can just put in where you're from today, it'd be great to see. So I'm just going to type menti.com. Just going to pick up. Yeah, so we've got Rupi from London. Hi, Rupi. Kavraj from Mauritius. Andy from Mauritius. Man from Mauritius as well. So obviously we'll have loads of colleagues there. Please put your comment as we start the survey. So I'm just going to put in myself 9874 0605. So I've got 30 seconds to go. Be good to see where you're from, everyone. Please, if you can put your comment in. Right, I've just got few seconds left before we conclude that one. So okay, so please put your comments. So most of you are from Mauritius today. We've got from one a Canadian flag, so it'd be good to see that as well. So we've got a few guys from the UK as well as from Canada today. So great to see you all for this amazing webinar. We've got 80 of you today right now, so fantastic. And I've got a few seconds before we move to the next menti.com. So thank you very much. And we've got also Ola from South Africa. Bianca from South Africa as well. Great to see you. So we've got a few guys from different countries today, and it's excellent to see you. So Mauritius being in the blue, meaning that most of the participants are from Mauritius today. So fantastic, and we'll move on to the next one. And just quick thought, what are your thoughts for the future when it comes to COVID-19? It can be anything. So it'd be good for the doctors to know your thoughts. What's your thinking behind what's going to be happening next? Is it going to be gloomy, pessimistic? What's your thought? Anything, just put anything in there. But it'd be good to know what of your thought. Wow, this is good stuff. Scary. Yeah, we're all scared. Changing culture. Absolutely. So I've got 3 rows there for you. Again, if you could just please put that in there as well, that'd be good. And yeah, so uncertainty. Wow. So already it'd be good for the doctors to get a bit of what you're thinking. Needs God help? Right, okay, that's interesting. So more prayers for all of us here. New normal, new culture, changing habit. Scary is coming a big one because few people have talked about scary. The vaccine will save us. It's like influenza. So already the doctors and Youven, once you kick off, you'll see the 3 big words is the new normal, uncertainty, and scary, right? The rest and the risk as well, the new passport. So these are the big words, and already 22 of you have already put your comments in. New wave of doing business. Of course, we're talking about the new normal. So thank you, everyone. As I move to the next slide quickly, before we introduce Dr. Youven. Thanks all for your comments on that one. I'll move back to the slides. If you can see my slide, if you can put your hands up, please, that'd be great. So I just want to show you a quick video, everyone. And before we really introduce the panelists, and as I said, it's really a massive thanks for all the key workers and everybody else around the world. So I'm just going to switch back to the video. And if you can hear the sound and the video playing, please raise your hands up, okay? So just making sure I've got that sorted out. Right, and then I'm just going to blow that up now. Thank you. Off we go. Right, off we go. Okay, so just moving back to the slide again. So thank you very much indeed, everyone, to watch that. And as we move to the next one, thank you for that. So we're just going to do a quick survey before we really present the. So I'm just going to share a survey with you all as we go to the survey. And the first one is, I'm just going to start that again and relaunch polling. Off we go. So if you can please let us know. If you can vote on that, how many of you have been vaccinated so far? Again, it'd be great to see what Dr. Youven will be obviously sharing with us shortly. So you've got about 30 seconds for the vote in terms of how many of you have been vaccinated. Okay, so please put your vote in. You've got 30 seconds left. How many of you have been vaccinated? Be honest, be truthful. Of course, we have some element of scarce as well, an element of fear. Some of us are just going for it as well. So it's important to know your views as we kick in. So already 90% of you have voted, and I'm just going to end polling now and then share the result. So I'm going to share the result with you, and Dr. Youven, if you can put your video on, please, because you'll be the first to present. So it'd be great to have you on board. And obviously, so Dr. Youven, what do you think? How many of us have been vaccinated? What's the percentage, do you think?
If most of them are in Mauritius, maybe 20 to 30%, I think.
Wow, awesome. Let me share the result with you. And the results are here. 35% have been vaccinated, and a whopping 65% has not been vaccinated. So already, again, Smruti, if you can make a note of that with Dr. Vinod and Dr. Umesh that we can pick up later. And I'm just going to launch another one quickly, which is from Dr. Umesh, actually. This is a good one, and I'm just going to launch that as well. How many of you are worried about COVID-19? How many of you are worried about COVID-19? It's just, again, you might not be worried about it because you're resilient, will fight back, but some of us are vulnerable about it. Traditionally, we're a bit vulnerable as well. So how many of you are worried about COVID-19? And Dr. Youven, what's your thought on that in terms of percentage?
I think more than 50%, because to be frankly with you, I am also scared of COVID-19.
Wow.
Even if we have all the information, everything, we don't know what's ahead for us.
Okay, so I'm just going to end the vote now. 80% of you have already voted, and I'm going to share the result. And it's a whopping 85% are worried already. And we've got 15%, that's okay, we will fight back. But what's your thought on the 85%, Dr. Youven?
That's expected, because we are in, we don't know what's expecting ahead. We don't know if the vaccine will have to do it every year, like the flu. It will be a one-off. We have so many uncertainties. Today, we'll try to discuss all of this, but it's normal to be scared. It's absolutely normal.
Thank you, Dr. Youven. If you can take it over, share your screen, please, and your PowerPoint slides. And then as we said, so already we've seen 2 polls already. We've got a few more polls coming up. Obviously, Dr. Vinod and Dr. Umesh with Smruti will pick that up later. So if you can share your screen, Dr. Youven, and we'll take that away. Of course, put your question in, everyone. Also, you can, Dr. Umesh will reply to all your questions as well. He's very good in replying, Dr. Umesh. So, yeah, we can see a screen full slide. Fantastic. We can see it all. Everybody, if you can see Dr. Youven's slides, please put your hands up. We can't see you though, Dr. Youven. We can't see you.
Yeah, I don't know how to do that.
Just put start video, I think. Did you just, but it's no problem. If we can't see you. It's fine, as long as we get the presentation going.
Yeah.
All yours, thank you.
Okay, so hi everyone, I'm Dr. Youven from Mauritius. So today we'll be having a small presentation on COVID-19, the current situation in Mauritius. So we kick off. So what are the current statistics that we have in Mauritius? Till now, from March last year, 2020, till today, we've got 860 confirmed cases of COVID. What I mean is that 860, the first cases that we've got was in March last year. You can see from here, we had a small peak from here. And then on the 20th March last year, we got the first lockdown in the island, whereby the Prime Minister told us that we'll be in lockdown and it started in March. It ended around the 15th of June from here. When we went in lockdown, it was quite scary for everyone. Even for me, we've never been in lockdown. We were unable to go around to buy our groceries. But that lockdown helped us because as you can see, there was a drastic decrease in the number of cases. And then when there was no local cases of COVID-19, around the 15th of June, the lockdown was lifted. And from June till February, February this year, we had only imported cases. What I mean by imported cases was only patients coming from abroad. There was mostly students coming from abroad, people going for business. So a few tourists, they were coming to Mauritius. We were placed, automatically, when you come from abroad, you were placed in quarantine for 14 days in Mauritius. And if ever you're tested positive during those 14 days, you were transferred in a specialized hospital. So till January, end of January, there was only imported cases. We had around 38 imported cases by the end of January. But at that same period, we got a few local cases started. We had 15 local cases. That's when they put the second lockdown. So right now, we are in the second lockdown. It started on the 10th of March. It was supposed to end on the 25th of March, but they extended it to the 31st of March. Last year, we had only 10 cases of persons who died due to COVID-19. And following March, April, we had no death recorded, but just today it was announced that one person was passed away due to COVID-19. However, it was not a local case. It was an imported case of someone from Madagascar who came to Mauritius. He was already in a severe bad state. They had to put him on ventilation, and his state did not get better. He was not stable at all. Unfortunately, he passed away today itself. On our next slide, I will show you how it's going right now. So we are in the second lockdown. It started on the 9th of March. And it's expected to end on the 31st of March. I just say expected because we don't know what lies ahead. Right now, last year, we had cases all around the island, everywhere. But this year, on the contrary, all the cases are located in the center of the island, what is known as the red zone. We had 4 main clusters that we've got in end of February. The first cluster was in a factory. It was based in Wootton, Cupid, center of the island again, whereby one worker was tested positive and few of his colleagues also following which a few of his colleagues were tested positive. The second cluster was in Forest Side, center of the island again. It was during a religious ceremony whereby a few people got infected there. One student who attended that ceremony itself went back to his school the next day in a college in Cupid, and he infected his classmates and the teachers there. So we have the third cluster in the college, and the fourth cluster we've had was in another factory in Cupid, whereby a few workers got infected. All of those clusters, all those positive cases appeared in the center of the island around here. And most of those places around sporadic cases, they are all of them connected to that main red zone. So what happened is, even though we were in lockdown, the authorities announced that we will have a red zone whereby all the entrance and exit will be strictly controlled, whereby you need a special pass, special paper, which is called a WAP, to get in or out. Right now, we have 239 active cases. I think today we've got 18 plus. I'll just talk about it later. And 21 of them are cured. They are out of the hospital or of the quarantine. And 218 plus are still are still COVID positive. So what happens when someone is COVID positive? What we do right now in Mauritius is contact tracing. If someone is positive, there's a team called the rapid response team that goes to that patient. They start making the contact tracing. We ask him all kinds of questions, where he's been, what he's doing, if his kids have school, who are his classmates, etc. And then we identify all those persons, and those persons are placed in quarantine automatically. If during that quarantine period, the PCR is positive, they are taken from the quarantine, they are sent in the specialized hospital. If it's negative, they stay in quarantine for 14 days, okay? So how is the quarantine going on in Mauritius? All asymptomatic cases who were in contact with someone who was positive are placed in quarantine. In quarantine, what they do? They do 1 PCR on arrival, and then 2 PCR, 2 or 3, depending on the cases, at day 10 and day 14. If all of them are negative, the patient is allowed to go back home, but he's told to stay in self-isolation for 7 more days. If during that period, 14 days period, they are tested positive, they are sent to the specialized hospital, the ENT hospital, which has been turned into a COVID treatment center. What's important is all cases who have been in contact with someone who was COVID positive are sent in quarantine centers. So what is the solution right now? We have 3 main targets. One person should wear mask, should have social distancing, and one of the solutions is vaccination. What is vaccination? Vaccination is a safe and effective way of protecting people against harmful diseases. It creates antibodies to fight the specific infection without causing the illness. At the present right now, all current COVID-19 vaccines, they reduce the severe forms of the disease, mainly in the elderly or people with comorbidities. How is the vaccination campaign going on in Mauritius? We are using 2 main vaccines, the Oxford AstraZeneca. We got 200,000 doses from India. 100,000 doses has been used as a first dose, and the next 100,000 doses has been reserved as a second dose. After the Oxford AstraZeneca, we got the Covaxin, where we got 200,000 doses from India itself, 100,000 for the first dose, 100,000 for the second dose. Orders has been placed for Sputnik 5 from Russia, Sinopharm from China. We placed orders for 1.6 million doses of Sputnik 5. However, given the geopolitical situation, I don't know if we will be able to get those 1.6 doses. India has stopped exporting all his vaccine. We are not getting Pfizer in Mauritius. We are not getting Moderna in Mauritius. So hopefully we'll get the Sputnik vaccine. We'll be able to discuss about it later on in the Q&A if you want. The target is to vaccinate 60 to 75% of the population by August 2021. And to do this, we have to do approximately 7,000 to 8,000 vaccination per day. What are the different vaccines? I know Dr. Vinod will have a presentation on the vaccine more in detail later. I'll just give you 2 slides. We have Pfizer, Moderna, Sputnik, Novavax, Oxford AstraZeneca, Johnson. We have Sinopharm, we have Covaxin. You will see they have all different types of efficiency. However, the most important thing that you should know is that all of them, they do the same thing. They prevent you from getting the severe symptoms. They prevent you from going into hospitalization. They prevent you from dying. You should know that when you get vaccinated, it does not prevent you from getting infected, but it will prevent the severe forms of the disease of COVID-19 to evolve in your body. And what is very, very important for you to take out today is that all of the vaccine, they are 100% efficient against death and hospitalization. It does not depend what vaccine you take. It's 100% efficient against death and hospitalization. So right now in Mauritius, we are using those eligibility criteria. In Mauritius, we have this. Each country, we are having different criteria for as I do. If you cannot get vaccinated, if you have a history of severe allergy, what is severe allergy? Severe allergy means swelling of eyes, swelling of lips, angioedema, you can't breathe, you have to get hospitalized, they have to give you cortisone, etc. That is severe allergy. Many patients that we are getting better, yes, we have allergy, but when we ask more details, it's just rashes, it's just itchiness, it's just some redness. This is not severe allergy. If you have any history of allergy following any vaccination, you can't do it. If you had a reaction following the first dose of the vaccine, you can't do it. And if you have any vaccination 14 days prior to COVID-19, you can't do the vaccine. In Mauritius right now, they say that you can't do the vaccine for pregnant women, breastfeeding women, women who are planning for pregnancy. This is in Mauritius, but I know in some other countries they are allowing it. But right now here, they're saying that they don't have enough information to allow vaccination for this category of people. And the same thing applies for persons below 18 years old. They have not included kids in the trial. So we are not doing vaccination for persons below 18 years old. Furthermore, caution should be exercised for patients who are having an acute infection. If we are having fever, we are telling them to come back after 15 days. Patients who are on antiplatelets. What are antiplatelets? Aspirin, clopidogrel. We are telling them that the vaccination should only be done. In fact, for everyone, we are doing the vaccination only in the deltoid muscle, that is the muscle in the arm. And before they do vaccination, they have to take the vaccinator, that they are on aspirin. So the vaccinator will do a compression for 5 minutes to reduce the risk of hematoma, that is swelling, blood accumulation at the point of injection. If someone is on warfarin, anticoagulant, we tell them to bring the INR results, and it has to be within the target range. And for the COVID-19 vaccine, for whom it's highly beneficial, person over 60 years old, obese person on diabetics, cardiovascular diseases, heart diseases, respiratory illness, people on hemodialysis, cancer patient, immunocompromised patient, HIV patients. And for HIV patient, we are using the marker CD4. If it's less than 200, we are not doing the vaccination. If it's more, we are considering and we're doing. For someone who has been COVID-19 positive for the last 3 months, we are giving only 1 dose because he already has the antibodies. I know in some countries we are giving the 2 full dose, but only after 3 months. In Mauritius, we are giving only 1 dose. Why do people are scared of getting the vaccine? It's mainly because of the side effects. Something that you have to understand, but the side effects that you're getting is absolutely normal. Yeah. It's absolutely normal. You can't stress enough on it. You have pain at the site of injection, get fatigue, headache, fever for 1-2 days. For the first 24 to 48 hours, you have those side effects. And what we found is that after the second dose, the side effects are even higher. But again, it's absolutely normal. My personal experience, when I did my AstraZeneca vaccine, I had high fever, headache, weakness for 1 day. I took some paracetamol every 6 hours and it was gone after 1 day. It's absolutely normal, and mostly everyone are having it. Mainly the youngers are getting the side effects than those above 60. Again, absolutely normal to have it. Right now in Mauritius, we are using the Covaxin and the Covishield. The Covishield was developed by AstraZeneca and manufactured in India from the Serum Institute. It's a non-replicating viral vector, that is an adenovirus. that was causing flu in chimpanzees. They work on it, they make it not replicating, and they inject it in your body, and your body manufacture antibodies to fight it. And as a matter of fact, we manufacture antibodies to fight the COVID-19 virus. Covaxin, it's a coronavirus. They made it inactive. It can't replicate, but the spikes are still present. So when it gets in your body produces antibodies. So if ever you get coronavirus, the antibodies will still be here and we will fight it. Both of them are ideal for Mauritius because it can be preserved between 2 to 8 degrees as compared to Pfizer, which was minus 70 degrees. For Covishield, we do 2 doses, the second dose of the 3 months, and for Covaxin, the second dose of the 28 days we are saying right now. What you need to understand as well is that for Covishield, it's 70% efficient. For Covaxin, we have only the phase 3 trials, and the phase 3 trials results showed 80.6% efficient. The Covaxin, it's approved by the Indian National Expert Group on Vaccine Administration. All the countries for taking it, they are approving it at national level. For Mauritius, it was a pharmacovigilance committee. However, the Covaxin is not yet approved by WHO.
Yeah.
It's not yet approved by European Medicine Agency. But in all the other countries, it's getting approved. Hopefully, with the results that we are sending there, it will get approved. So how does the vaccination go on in Mauritius? First, we have 14 centers around the island. When you go there, you'll be asked a series of questions by the doctor. You'll be asked about your past medical history, past surgical history, any allergy if you have. If everything is good, they ask you if you're pregnant, if you have, how's your immune system,
Yeah.
etc. And if everything is good, then they will tell you about the side effects. Like I told you, all the side effects are normal. We might have arms, soreness, we have fever, tiredness, headache, absolutely normal. You sign the consent form, and then you get vaccinated. After getting vaccinated, you will be observed for 15 to 30 minutes. For Covishield, we were doing 15 minutes. For Covaxin, we were doing 30 minutes. And if you don't have any adverse reaction, then you'll be given your green card, whereby the date for the second dose will be written on it. There's a special hotline that has been put in place. If you ever have any adverse reaction, if you're not feeling well, you can contact us on that hotline, and a mobile team will come to see you and provide you with treatment. So what is the target right now? As for today, I think we've reached 130,000 people vaccinated in the island. And to reach herd immunity, we'll need at least 700,000 people getting vaccinated. What is herd immunity? Herd immunity, as you know, there are some people in the country all around the world that can't get vaccinated. Small kids, people who have some allergies, pregnant women in Mauritius, they can't get vaccinated. What we are saying about herd immunity is that if everyone around those persons are vaccinated, as you can see from here, the virus has very less chance of getting to the person who's not vaccinated.
Yeah.
If the probability decrease, then that's what we all herd immunity. So the more people who are vaccinated will be able to protect the more people who can't get vaccinated. So to end my presentation, I just want to tell you something. Everyone, I get big questions each time, which one is the best vaccine? But the question is not which one is the best vaccine. The question should be, when can I get vaccinated? Because as I told you, all the vaccines that we have on the market, they are 100% efficient against death and hospitalization. So you should get vaccinated if you can. If you don't have any allergy, you should get vaccinated. to protect you, to protect your family, to protect your loved one, and to protect your country. That's it. Thank you. And if you have any questions, I'm more than welcome to answer them.
Okay, awesome. If you can stop sharing, and if I can have Smruti, can we have a big round of applause as well for Dr. Youven from Mauritius? I think that was really, really informative. So if you can put your hands up for Dr. Youven, Smruti, Dr. Vinod, and Dr. Umesh, can I have you back on the screen, please? And also Smruti, and if you can unmute yourself. So maybe Smruti, you've already picked up some question. Please pick up some question and see if we can do some, transatlantic knowledge between the doctors in the UK and Youven.
Okay, I'm going to start off with a question. Maybe it is for Dr. Youven.
Yes.
One analyst has asked that the various testing carried out for COVID-19 in Albio and Lakavan, but when the people are, those people who are tested and they come out negative with a negative test, and after a few days it can also be they become positive. So how is Mauritius controlling that? And do you think that the same people who are infected and have been positive, should they have a test redone for COVID testing within 14 days? How many days should between?
So normally what we are doing is all the birds who we got through contact tracing, we are placed in quarantine for 14 days. However, it's still possible to get the virus to become positive after 14 days. It's a question that they place at the task force, national task force. So personally, I should suggest that if you've been tested positive and if you're having the symptoms again, you should get tested again to see how it is. I mean, if you were positive and negative, you exited the quarantine period, but when you develop the symptoms, get tested, self-isolate till you get the results. It's to protect yourself and protect your family. It's possible to be infected, reinfected afterwards. It's still a new virus. We're still learning through it. So the possibility is still there.
That's a great answer, Dr. In UK, I've had many people had the same question and they're doing similar things what you've suggested. I've got friends who had a similar things. Anybody wants to speak on that, or is it okay? Dr. Umesh, Dr. Divasan, you want to share your views, or Dr. Umesh?
Same principle, and we are doing test and trace a lot here. So it's the same principle. This is a new virus and we are all studying. Some people are questioning the effectiveness, but still we are continuing with it.
Yeah. Okay, the next question is from Laksha, that if, what do you think? If once we have the vaccination, will we be immune for life, or will we have to again?
No.
What are your views on that?
The vaccination, what we've found is that it might be effective for 7 to 9 months. We don't know yet. So how I'm seeing it is maybe it will become like the flu vaccine, that every year we might need to do it. Again, we're still learning, but my personal view is it might become like every year we do the vaccine again and again till we don't get something that totally control it.
I think Dr. Vinod had a very, we've shared this before. Dr. Vinod, can you elaborate on this, please?
Yeah, if someone gets a vaccine, it is likely that it, like you once said, it's likely to give protection for about 6 to 8 months, or maybe even longer. But if you did the antibodies, you will detect antibodies for a period of 2 years. In UK here, they're now having some talks about revaccinating or a booster vaccine in so September or October sort of time. And as Youven was mentioning that I think for this virus, we may have to take every year a booster probably for the next few years, just like flu vaccine.
Okay. The next question I have from a panelist is that can the 2 vaccines be mixed? Like suppose if you got one vaccine, COVID-19, mix it with Pfizer. Is it
So I saw one paper from WHO. The WHO said, no, don't mix, no mixing at all. If you get Covaxin, second dose Covaxin. If you have Pfizer, second dose Pfizer. So everywhere, all the official papers are saying first dose, one vaccine, second dose, same vaccine.
That's an important point. If you take first dose is by AstraZeneca, second one is AstraZeneca, because you produce memory cells and they will react only to the vaccine which you have taken the first time.
Yeah. And do you think among all the panelists, do you think it is feasible? Is it right to keep the vaccine for 3 months? Because one of the person is asking me, I think the vaccine, if he took the vaccine on 10th March, do you think 3 months taking the next second dose on 10th June is good, or do you think the period should be shortened between the vaccines?
1 to 3 months is recommended, but it's not going to affect. You will have cells, so you will be protected even if it's as long as you take within 1 to 3 months.
Yeah, I think one of the questions which is for Dr. Umesh, why should you take the vaccine on the right hand or left hand and not the right hand?
It's actually just a habit, because most of us are right-handed. Doctors tend to give on the left side. That's all. You can take it right hand, left hand. Sometimes in children, I have given into the thigh. So anywhere you can give it.
Dr. Umesh, just a quick one. The sound is coming quite bad. It's creaking. Could you just check the sound, please? Thank you.
Okay.
Okay. The next question is for myself, Dr. Youven. This is for you. Mauritius had imported cases. How come that there were more imported cases and it was not controlled in the initial? If there was a basic system there, then you wouldn't be in this situation.
Yeah.
So, because the government is taking now intervention, but what are the tight restrictions taking?
So what my personal view is that someone from quarantine was tested negative, but still he had the virus. And when he went out, the virus manifested and he spread it. Or I don't know, I think in many countries also like this, maybe someone did not do the full quarantine. I don't know what happened. So, but I'm sure that someone imported the virus, went in the community, still had the virus, and started spreading from there. In the beginning, they were saying that it was from packages, it was imported packages from South Africa. But then they did tests and it was negative. It was not on the packages. So it had to be someone from abroad who brought it here.
Yeah, to all of you doctors, because you mentioned the package, Dr. Gadiyar and Dr. Umesh, what are your views on that? Because do packages, if touching care packages and things like that, bring viruses back? People are washing their fruit, vegetables, milk bottles, things like that. Do you think we should go to that extent to take precautions?
I think in the initial days, I was very, very cautious. Yes, we would, if we bring any items from the supermarket, we used to wipe it with 70% alcohol, etc. We are not doing it as much now. I think virus can still be alive on the surfaces, especially on the metal surface and also on the cardboard. So that is why we were taking more and more precautions. But now that we are having some vaccine, etc., probably we are slightly bit more protected than before. So we may be able to relax a little bit.
Youven, is that do you think that in my opinion, a lot of medical staff are private in Mauritius. The doctors operate privately. Now, COVID vaccination, you say it's free. Do you think the people, doctors will import and sell it privately to certain clinics?
No, in fact, what they are doing
or will it not be allowed?
The public sector is giving it free of cost. And if you approve clinical settings, they are taking a minimum charge. Like in India, they were doing 250 rupees. In Mauritius, they are asking 300 rupees to do the vaccination, only a minimum charge. But the government is providing the vaccine. And it has to be, the center has to be approved. Like we were asked also to do vaccination at home, but it's not possible because this vaccine, we don't know what kind of reaction might happen. If in private practice you do it, you need to have all the settings. But if ever the patient has a severe allergy, if ever you have any problem, you should be able to resuscitate, to intubate, etc. In those settings, they have all those facilities. Wherever we are doing the vaccination, we have the facilities to, in case of any emergency, we can see the patients. But if you're going in a private consultation, it won't be possible to do the vaccine.
Okay, Dr. Youven, I've got a question for you. Mauritius is growing very fast with the COVID at the moment. I see that cases are increasing day by day. Do you think Mauritius has got the infrastructure in the public sector to protect COVID patients? Like, do you think doctors are qualified to deal with, severe COVID cases? And how will the private sector doctors will come join together? What are your views on this?
So if we count only the public sector, it will, in the worst case scenario, it will be extremely difficult. But if we join hands with the private sector, still we have the facilities, we still have the bed, but in a worst case scenario, it will be extremely difficult. Worst case scenario meaning all the ICU beds are taken up everywhere. We have to ventilate patients. We don't have those kind of facilities like to have 2,000, 3,000 patients on ventilation. It would be extremely difficult. But what we are saying is that the current cases that we are getting, it's all the patients, they are positive, yes, but they have only mild or moderate symptoms. We are not getting severe cases like last year. But if we start getting the South African variant, if we start getting the Brazilian variant, then it might be getting very, very difficult for us.
Okay, the world is going that way. There have been a lot of variants in UK, and I'll let Dr. Gadiyar answer that in how the variants differ and what is the thing. The next question is, how, Dr. Youven, you're a doctor, what has been done to protect the mental health of all the people in Mauritius and the mental health of doctors who are going through this stress? Because now Mauritius has got more cases compared to last year. You can see that clearly. Last year it was only few cases, now it's increasing rapidly. So what are your views on this?
My views are we are having very stressful days ahead for us, doctors, nursing staff, etc. But frankly speaking, nothing is being done. There's no support, nothing is being done for our mental health or for all the health sectors. We are only concentrating on COVID positive patients, getting positive, giving them their treatment, etc. But in terms for our own mental health, nothing at all.
Don't you think you as doctors and other people should set up a mental health charity in Mauritius for everybody? I don't see that happening. From my point of view, it's a worldwide phenomenon. Why is it not being done in Mauritius? Can you explain it? Are there things which could be done to help everybody?
Yeah, hopefully we'll get it done. We have to get the right-minded people to work on it. Like right now, everyone is around, we are doing our own stuff, but it has to be done. We have to get the right team, set it up, and get it going.
Okay, thank you so much. I think those are my questions, and I'll have a few questions relating to some injection, which I'll come back later. Thank you so much.
Thank you again for having me on the talk.
No problem.
Smruti, shall I start or?
No, unmute Anil. Anil is speaking. I think he...
Can you hear me now? Sorry. Yeah, so there's a question from Shilpa. I think it's been picked up, but Shilpa, which is the sister of Smruti, do we have any information on when the vaccine, Covaxin, will be approved by WHO?
Personally, I have no information.
Okay. And then we've got a question from Seda. And Seda goes on to say, is the vaccination recommended for hemophilia patient? knowing that they have weak immune system?
Yeah. So what we've asked is that what we've been told is that patients who are hemophilic, they can do the vaccination, the co-vaccine. We don't have any issue as long as they are stable. And you should tell your doctor if ever you had a recent blood transfusion, so that it's mostly on a case-to-case basis.
Okay, thank you, Raj, indeed. There's a question there as well, maybe for everybody, right? Is it wise for a person of 80 years old to get vaccinated? I'll start with Dr. Umesh on that one.
Absolutely right. Older patient must get vaccinated. Very important, because older patient, they have got severe disease. Patient with diabetic obesity got severe disease. And hemophilia, just want to tell you, I was a pediatrician. They don't have immunodeficiency, so they can be vaccinated.
All right, thank you. Dr. Vinod, 80 years old, do they have to be vaccinated?
Absolutely correct. They should be vaccinated, because one of the most important thing about the risks of death with or severe disease with COVID is age. So older you are, the more vulnerable you are. So in the UK, they started to immunize patients according to age. So oldest ones were given the vaccine first. So 8 years of age, 100%.
All right, fantastic. I've got a question from, I think I picked up another question there, which is more there's a question there, I think it's an important one from Sajjad from South Africa. Can cancer patient get vaccinated? I'll start with you, Ben, on that one.
Yes, we've done vaccination for cancer patients. In fact, we've set up in our cancer facilities. We went there and we did vaccination for the patient there itself. Even for patients on dialysis, we've done vaccination there as well.
All right, thank you. There's a question again from Shilpa. Can people allergic to penicillin be vaccinated? Maybe Dr. Vinod on that one.
Definitely, yes.
All right, thank you. I think we've kind of closed everything. And I've got one more question from Jean-Luc. Jean-Luc is just saying a statement. All this vaccine being carried out now, are you aware that we are still not protected now? We need to complete the second one in some week time, and then that's just a statement. Thanks, Jean-Luc. I think we've got everything else. There's a question from Bay.
Some questions are picked up for the general panelists. I thought if Dr. Youven goes, then won't be able to answer. So that's why those questions are.
Okay, so we'll leave those questions there.
Yeah, but as you've asked a question, Dr. Youven, you've laid down a lot of why these people should not be taking vaccines, like pregnant and things like that. What are your views on those, Dr. Vinod and Umesh, Prabhu? Are all this similar in all the countries, or all these countries are indigenous? Because that's what the question is becoming, allergic reactions and contraindications. And should we have a consent form for people to sign before they take the vaccine?
I have in my presentation about this. I think some countries are introducing their own guidelines about what needs to be done before, or what are the indications and contraindications for vaccine. I think it is very well known now that as and when we are using vaccine more and more, now we have understood that it is safer and safer in many aspects. For example, they have done a study in pregnant patients, and now it is deemed to be as safe in pregnant patients.
Okay.
So when Dr. Youven is saying about the contraindications, meaning that certain people shouldn't be taking vaccines in Mauritius, do you think it should be allowed, or it should be taken as a generalistic approach that all the patients should be vaccinated? Because age and things like that shouldn't matter. That's what my view is. Age, certain conditions, should they matter, or are they taking a very strict approach in Mauritius?
Okay, I think it was a question to Youven, but we are running out of time because we've got 2 more presentations coming up. So just quickly, Dr. Umesh and Dr. Vinod, what's your advice to Dr. Youven? Obviously, Dr. Youven is out there at risk helping us. What's your advice being is 30 years practitioner in the industry. So starting with Dr. Umesh, what's your advice to Dr. Youven, who's obviously coming through the ranks?
His presentation was absolutely brilliant. He has got a fantastic knowledge. I think he's doing a fantastic job, and every country has got their own guidance, and he is following the right guidance now. There are very few conditions where you should not give it, and that is what. And some countries started with 18 European countries banned AstraZeneca, but now quite a few of them said it is safe vaccine. I'm convinced it is safe, and I think your country has got less problem compared to UK, and we know they'll cover it up why.
All right, thank you, Dr. Umesh. And Dr. Vinod, before we let Youven go, quickly your thoughts on and some advice to Youven on that one.
Yeah. Youven's presentation was absolutely fantastic, as Umesh said, and he has got the right attitude there, and have got all the procedures in place for preventing the spread of the disease and also getting the vaccine. But the problem with vaccine is that vaccine, there is a bit of political side of things, there is a bit of science side of things, then there are few people who don't believe in vaccine, etc. So these are making difficulties as far as vaccination is concerned, but also there is shortage of vaccine worldwide. So Mauritius is also facing that problem, and I'm sure in the time to come Mauritius will get good amount of vaccine, and at least 70% of the people can be vaccinated to get the herd immunity.
All right, thank you. Smruti, what's your final advice? Obviously, you've been dealing with this quite a lot in the UK. What's your advice to Youven? And then I'll get Youven the final word.
Of course, it's very important to protect yourself. Have the vaccine. I've had the vaccine, and if you're getting it free in Mauritius, why are you hesitating? And please make sure that you are wearing masks and protecting yourself, and don't mix with people. Also, I've suggested to Youven, maybe Mauritius should set up something, mental health charities or something, because COVID, a lot of people are going through different situations. And that is my strong advice, because Mauritius is now getting more and more cases. So you need that sort of thing. It shouldn't be a stigma. Thank you so much for help.
Okay, Smruti. And Youven, what's your final word? Just before I let you go, Dr. Umesh recruit doctors for UK from NHS. So you might be getting a job to the UK soon, mate. But just quick one, what's your final thoughts on whatever's happening before we let you go? And the doctors in the UK, of course, today.
Yeah. Thank you so much for all your inputs. What my final words would be for everyone is, as soon as possible, get vaccinated. Stay safe, get vaccinated to protect your loved ones, to protect your family. Because if we can't say the only solution is vaccination, it's part of the solution, but get vaccinated as soon as possible.
And Dr. Youven, just quick one before you go. On Facebook, there's lots of things going on. Could you give us some advice not to believe anything that's been thrown on Facebook? Yeah.
Don't believe all those fake news. Lots and lots of fake news going on. Don't believe them. Get your sources straight. Listen to people who are knowledgeable about it. Read journals. If you want more information, read official journals. But the most important thing is get vaccinated. Get vaccinated. Yeah. I can't impress on this.
Okay. All right.
So, Dr. Youven touched on it. Because people are reading on Facebook, I think you should put this seminar full on Facebook and all on social media, so they can get the advice from Dr. Youven himself, who's a professional. Thank you so much.
Absolutely. Okay, Dr. Youven, thank you very much indeed. We'll
thank you.
Go.
Thank you.
And we have a big round of applause for Dr. Youven from Mauritius, from our own country. So thank you, Dr. Youven. Let's move on to the presentation with Dr. Vinod. So Dr. Vinod, if you can share your slides, and we'll move back to the UK now for our next presentation. And if I can ask Smruti to switch off the video as well, and Dr. Youven. So if you can share your screen, Dr. Vinod, as we go back to the UK for a presentation from Dr. Vinod Gadiyar. So if you can introduce yourself quickly as well for a few minutes before we move on to your presentation. Thank you, and take it away. We just need to unmute yourself, please, as well. And just go full slide on your screen. Yeah. And don't forget to unmute. Just ask to unmute. I think, yeah, if you can, yeah, you've unmuted yourself, fine, perfect.
Okay, I've unmuted there.
And then just go for full slide, go to slideshow. That's it.
Full screen, yeah. Okay.
Yeah, perfect, all good, let's go.
Okay, thank you very much. And it's been a great honor to be on this webinar today. And I would like to thank Anil and Smruti for organizing this fantastic webinar. Greetings from Manchester in the UK. And I'm really happy to share the knowledge that I have with you so that all the information will be easier for you to understand to fight this disease and get rid of this pandemic. So you have seen this picture for a long time now, COVID-19. There are lots and lots of coronaviruses, but this COVID-19 is the one which has been described at the end of 2019. That is why it is named as COVID-19. COVID meant coronavirus disease. I'm going to just touch upon these topics, how COVID is affecting us, and what are the treatments available for COVID, how do we prevent this, and what are the vaccines available, and a little bit about what is called as long COVID, and then we will have a good discussion. Basically, as I was saying to you, the WHO announced COVID on the 31st of December 2019, and the WHO recognized it as a pandemic on the 11th of March 2020. I remember now that last year, March, which is 2020, March 5th, was the first time, was the day when the first death of a UK patient occurred. If you look at globally, we have had 123 million people who had this disease, out of which, sadly, 2.7 million people have died. As far as UK is concerned, there are about 4.3 million people who have been affected by this virus. If you know, the population of UK is about 65 million people. And 126,000 people have died. The more people died in the second wave than in the first wave. As far as USA is concerned, there are 30 million infections, but look at the death rates there, 550,000 people, and Brazil is not very far behind with the 300,000 deaths. When compared to that, Mauritius, about 800 people who have been affected and 10 deaths have occurred. But even one death is too many for this dreadful disease. So how patients are affected? If you look at, say, something like 300 people are there in the community who are getting affected by COVID-19, about 30 or so will get admitted to the hospital. And out of those 30 or so, about 2, 3 or 4 people will get a real severe disease. And then they will have to be supported mainly by respiratory support, which is ventilation, CPAP mask, or high flow oxygen. And out of that, those patients, about once when the patient is on the ventilator, then their chances of coming out is only about 30 to 40%, not any more than that. My experience with the COVID is that I have worked in the COVID intensive care unit, where I have myself intubated something like 22 patients, and they, some of them have survived, some of them have not survived. But it is very, very difficult to treat these patients because they are so hypoxic. Hypoxic meant their oxygen levels are so low down. The oxygen you need for life, but in spite of being so low in their saturation, they still be talking, which is a completely different kettle of fish when compared to any other respiratory diseases that we have faced in the past. Then we have got, as it's been mentioned earlier, variants. Any virus will mutate, and there are variations that occur. Very, very commonly, we have seen the flu virus, uh, which mutates, and every year we have to change the vaccine slightly. So that will happen with the COVID as well. So the Kent variation is the UK variation, and this is the one which is the first variant that has been discovered. It is not that there will not be any variations in anywhere else, but only in here. No, because UK has the capability to identify these variants. Then we have heard of Brazil variant, and South African variant, and Finnish variants. But there is nothing to fear about these variants. They may be slightly more virulent, they may spread a bit faster, but if you take vaccine, 95 to 99% of the times, it will protect you from these variants as well. So there is nothing to fear about with these variants. Now we are here nearly finished with the second wave, and there is a third wave which is happening in Europe. I think in another 2 to 3 weeks, we may be expecting a third wave in here as well. I was talking to one of my good intensive care colleagues just 2-3 days ago, and he said we are now talking about 4th, 5th, and 6th wave. So there is more to come with COVID, but hopefully we'll be able to control it better, because we have understood the disease a bit better now, and also prevention strategies have been in place now than say 1 year ago. I'm just going to go over this because just to reiterate, if people
just
are not...
Just a quick question as well, just a quick one, Dr. Vinod. I've got a survey which I would like to pass. I mean, we have the question of the survey. So if you're okay with it, I'm just going to allow the survey. And just as well. So I'm just going to launch a survey quickly as Dr. Vinod is going to move to the vaccine. Do you have reservation to have a vaccine? I think we've talked about it quite a lot, and be good to know the participants what they think, because I know you'll be touching on that shortly. So do you have a reservation, or do you have reservation to have a vaccine? Please put your vote in. I think it'd be good to know before really Dr. Vinod move on to that one as well. So already 50% of you have already voted. Do you have reservation to have a vaccine? And obviously Dr. Youven talked about that, and we had the panel discussion as well with all of you. We'll have a next panel discussion shortly. And I'm just going to stop. Almost most of you have voted now, and I'm going to share the result with you, Dr. Vinod. So 47% says yes, they have a reservation, and 53% says no. So that's for you for discussion. And then I'm going to run the other poll shortly, which we after almost when you finish. I've got one more poll for you in terms of the COVID reality.
Thank you, Anil. Thank you very much. So basically, I'm saying that how to diagnose. Some people still don't understand, because you know why I'm saying these basic things is because some people are having a bit of cough or a bit of fever, etc. They say, "Oh, this is just cold." No, it may not be just cold. You have to have the high index of suspicion and think that it is COVID until it is proved otherwise. So if you have high temperature, if you have the new continuous cough or loss of change in the voice, in the smell or taste, you must have the COVID test to prove or disprove that you have COVID.
Yeah, just click on the slide again if it's not going next.
I'm not moving. I'm not able to move this slide forward.
I
got it now. I got it. Yeah. So even if you are asymptomatic, it doesn't mean to say that you may not have got COVID, because the first 5 days are asymptomatic. So then only the symptom starts. That's day 1 to day 8, mild to moderate symptoms. If you are going beyond 9 days, then you are into severe symptoms. Beyond 14 days, really, really severe disease, and you may be heading towards ventilation. So tests that we do, as Youven was mentioning, PCR meant polymerase chain reaction test. This is the best test to identify that one has got COVID-19. So there is also another test called as lateral flow test, but it is not as accurate, but it is faster. You can get a result within half an hour. What is meant by antibody test? Antibody, so once when you get infected or once when you're given a vaccine, you develop antibodies. Antibodies, if somebody has had the disease, after some time, if you check his bloods, you will find antibodies. So who is affected more? And we have been discussing this earlier. Anybody aged more than 40 are more vulnerable than the younger ones for severe disease. And if somebody has got pre-existing disease like respiratory disease, diabetes, hypertension, cancer, and reduced immunity, they will be the ones who are getting severe disease. Because some of the patients that I have treated in the intensive care are the ones who are belonging to these categories of patients. Smoking can make your disease severe. BAME, which meant Black and Minority Ethnic Community within the UK, got affected more than the white counterparts in the UK. There are various reasons behind this. We can discuss it in the discussion if you like. Obesity is one of the worst things that can happen as far as COVID infections is concerned. The obese people are very much vulnerable. If you look at the 2.5 million deaths that have happened in the world, 2.2 millions are in the countries where more than 50% of their population is overweight. Unfortunately, UK stands number 4 in the ranks of being one of the countries where obese people are more. And I'll just quickly go through these drugs because you may have heard of these drugs. So I'll just mention what works, etc. So there are antivirals. Where did the antivirals come from? Antivirals are the ones which have been used for HIV infection. So this is what in the initial days, people got excited about using these medications. Lopinavir and ritonavir have been used, but some trials, one of the trials called solidarity trial, it has shown that it is not as effective. Remdesivir, I think Trump was given Remdesivir. It is FDA approved in USA, but we have found that it is not as effective. How about the hydroxychloroquine? Hydroxychloroquine was bought from India to USA in tons, but it's one of the antimalarials. It's found to be not useful. And another antiviral and immunoregulatory medicine called interferon B has been found not to be very effective. So what about anti-inflammatory therapy? So we did some trials here called, I've been also part of this trial where we have trialed various medicines which are useful for which were trialed in patients who were really bad in intensive care unit in the UK, and they found that the dexamethasone is the one which saves lives or reduces the severity of infection. Then this trial is called as recovery trial, and because of this trial, now worldwide dexamethasone, which is a corticosteroid, is used to reduce death rates. There are also other medicines. One medicine called tocilizumab and sarilumab. These are effective, so these are being offered to our patients in the UK. What about convalescent plasma? Plasma meant, say, somebody who has had the infection and they develop antibodies, as I was saying to earlier on. So what if we take their plasma and give it to patients who are suffering from severe COVID disease? This has been tried in many countries, including India and also in the UK and mostly in USA, but they have found that it is not as useful as it was thought once before. So as I was saying to you, prevention is better than cure with anything in life. So this is very much true of COVID. So we have a mantra in this country called hands, face, space. That meant wash your hands and sanitize your hands with 70% alcohol, and always cover your face. In the past, they used to say face covering. Now we say mask. I would say use a surgical mask more than just cloth mask. And then space. Space meant keep yourself at a distance of 2 meters if you're talking or doing anything like that. When we speak or when we cough, we get droplets out, and the droplets are rich in viruses, and this is the way the virus spreads. So please bear that in mind. I know that in some parts of India, they're not even wearing masks, and there is no social distancing. I see so many of the Indian soaps and Indian programs. I really get worried about how they're not getting any infection, or if they get one, if there is one positive person, he can spread it like wildfire. But obviously, good nutrition, exercise, and mental well-being are the ones which are protective. So Umesh is going to speak about mental well-being after me. What about vitamin D? So there are lots and lots of queries about this. Vitamin D is involved in protecting and increasing the immunity of our body. So nice guidelines even here in the UK now suggest that one should take 400 units or 10 micrograms per hour day per day. I take about 2000 units per day. That is a high dose, but you can take at least 1000 units per day. So we are in the topic of vaccines now. So I'm going to talk to you about the perspectives from global perspective as well as UK perspective. So there may be slight differences in our understanding about the vaccines, how they have to be given, etc., etc. So we can discuss these differences, but I'll just say about these vaccines now. So vaccines are the only way out of pandemic. So please, please, please don't have any hesitation in taking vaccine. Please take vaccine. There are more than 240 vaccines are in development in the world, and there are 48 trials going on. And this was mentioned before. COVAX syndicate is the one which is organized by WHO. The whole purpose is to distribute the vaccines very quickly, fairly, and safely to many countries in the world. So there are about 180 countries who have been signed up for this initiative. Commonly used vaccines are these: Pfizer, BioNTech, Oxford, AstraZeneca, and Moderna. These three are commonly used in the UK. However, there are newer vaccines coming out. One's called Novavax, and that is an American one. Janssen is a vaccine which can be given as one dose. Then there is Russian vaccine called Sputnik. Sinovac and Sinopharm are from China. In the Middle East and some other countries, these are commonly given. Covishield and Covaxin are the ones which are being used in India as well as in Mauritius. Covishield is basically Oxford AstraZeneca vaccine. Covaxin is the one which is being developed by Bharat Biotech in India. So why vaccine? So this is what Youven was saying earlier on. This is the picture that I like. On the right side, you will see a vaccinated patient. All the blue bars are the ones where you may have an asymptomatic infection, and at the top you may get moderate disease. That's all. But if you have not had vaccine, then your chances of getting severe disease and death is very high. So please take vaccine because the idea of vaccine is not to prevent infection. Idea of vaccine is to prevent severe infection, hospitalization, and death. So how effective? I just put it out here to say that all vaccines are effective. It depends on when these trials have been done in each country and what sort of data they have used, etc. That is why it shows 70%, 90%, 95%, etc. If I were you, I won't bother about this at all. Just take vaccine. So UK is the first country where first vaccine was approved by MHRA, and also the first vaccine given in the whole world. So I'm really, really proud of that. And the first vaccine that got approval here was the Pfizer vaccine. I myself have taken Pfizer vaccine. I took one dose end of December, and in the next dose was 3 weeks after that. All the trials that have been done about the vaccines suggested that you should take vaccine after 3 weeks. But in the UK, because they found out from reanalyzing these papers that if we give the vaccine, second dose of vaccine within 12 weeks, then it is still effective. So to give more vaccine, or to give vaccine to more number of people, the government here with the scientific advice took a step to do the vaccine between 3 weeks to 12 weeks. That is why up to 12 weeks. But each country is looking at differently. In India, I think Covishield vaccine is being given after 6 weeks after the first one. But up to 3 months, definitely possible to have it. In the UK, we have done more than 30,000 vaccine. And that means that probably about 50% of our population is covered. But what is more important is that how about the whole world? So 4.7 million, 479 million vaccines have been given all through the world. And in the UK, if you see the percentage or the number of, for 100 resident, 46.7 have been given. Chile is slightly there, slightly above UK. Israel has done really good, and UAE have done really good, but they managed it because the population is low. But all the country of UK size has done really well. So I'm sure all the countries in the world will do the same. Are vaccines safe? Yeah. In the UK, by the weekend, this weekend, I said more than 50% will be vaccinated. As Umesh was mentioning, there have been some problem in the Oxford vaccine, which I'll talk to in a second. But believe me, 17 million people in Europe have had Oxford AstraZeneca vaccine, and there have been hardly any problems. Some people think that there are some animal products like pork, etc. in the vaccine. There is nothing like that. And there is no insertion of electronic chip, etc. in the vaccine.
Dr. Vinod, just to let you know, we've got 5 minutes left for your presentation.
Yeah. I'll be finished very soon. Yeah. So is AstraZeneca vaccine safe? Yes, AstraZeneca vaccine is very safe. There have been some blood clots, incidents of blood clots. There were 37 blood clots incidents out of 17 million of vaccination. So it is very, very safe. So as far as vaccine is concerned, I talked about the efficacy. And if only 70% of the population is vaccinated, we can get what is called as a herd immunity. The newer vaccine is being given through the nose. So that is coming in the future, but it can prevent you from having asymptomatic COVID. Pregnancy, some countries they don't allow, but I think it's safe to give it in pregnancy. Allergies for food, drugs, latex, venom, etc. is very safe. Only severe anaphylaxis to COVID or any other vaccine, then you should not give COVID vaccine. So if vaccine, it should be given to a person who has had COVID before, you have to wait for 6 weeks before giving the vaccine. So if somebody has had plasma therapy with the for COVID, then the vaccine can be given 4 weeks after that. And severe COVID, if somebody has had 4 to 6 weeks after their disease is done, they can have the vaccine. What about corticosteroids? We need to reduce the dose of the medicine to 7.5 milligrams of prednisolone. And methotrexate needs to be stopped for 2 weeks before giving vaccine. And if somebody has got blood cancer and if they have had bone marrow transplant, we need to wait for 3 months before we can give vaccine, and if there is a planned operation, surgery, so we need to wait for 2 weeks before that. Yeah, and use of anticoagulants is quite safe. I'll talk about 1 minute on this, and I'll be finished. So there is something called as long COVID. That meant it is not just a disease when you get it, and 2 to 3 weeks later you'll be fine. Certain number of patients get ongoing symptoms beyond 3 to 12 weeks, and then they get this syndrome after 12 weeks, and it is not explained by any other diagnosis. So positive PCR is not a prerequisite for diagnosis of long COVID. There are two categories. One is called as thromboembolic. That means you can get disease because of the blood clot. You can get heart attack, or you can get other problems. But I'm not talking about that. I'm talking about a non-specific clinical feature where 10% of the people who have had COVID, they become chronically ill. I've seen so many of my colleagues and some nurses, etc. They are hardly able to breathe. This is after 6-8 months after having had COVID. So they can have this problem, and they can also have inflammatory and immune reaction, post-traumatic stress disorder. But most of the long COVID is the respiratory and musculoskeletal problems. You'll get vague pains, etc. So I'm done with my presentation, and I'm happy to take any questions. Thank you.
Just quick one. We've got one survey. Dr. Vinod, you talk before you finish there. Yeah, if you can just stop the screen, and I'm just going to stop now. Right. Just a quick one. I want to run this survey in terms of COVID-19. I'm going to run that through, and then we'll bring Dr. Umesh for a quick presentation before we go to the panel. We've got half an hour left. And I'm going to run this. With all the panelists. So, right, this is it. So, do you believe that COVID-19 is a real disease? And I think Dr. Umesh and Dr. Vinod have probably a few things to say on that. Do you really believe that COVID-19 is a real disease? Right? Obviously, your honest opinion, honest feedback would be much appreciated, of course. Do you believe that COVID-19 is a real disease? So already I can see most of you have voted. Got about 15 seconds. I know some of you might not see the question due to the geographical location around the world, but do you believe that COVID-19 is a real disease? So I'm just going to end polling now. Almost all of you have voted, and I'm just going to end polling. What do you think the result could be, Dr. Vinod?
I think at least I would say about 75% people think that it's real disease, but I'm worried about the rest of the 25%.
All right, and what about you, Dr. Umesh? What do you think? We can't hear you properly. Yeah, your sound is playing up a bit. It's squeaking. It's squeaking. Yeah. We're still struggling with your sound. I don't know what's happening with the sound.
I really don't know. 30% and 70%.
Okay, let me share the result now. And 80% says yes, it is a real disease. And 20% is saying no, it's not a real disease. We've got 100 of you right now on this platform. So what's your thought, Dr. Vinod, before we let you go and have Dr. Umesh?
Yes, this is what I was saying, isn't it? But those 20% people, I still want to tell them that COVID is a real disease and a real problem. And I have treated patients, and the patients die in front of you.
Wow.
It is not like any other disease. It is not like pneumonia. It is not like simple infection that gets worse, sepsis, etc. This is a really, really, really bad disease, which will definitely kill you if you get a severe disease. Now, yesterday, so this 4 days ago, we had one patient who was with us for about 25 days. He's a younger patient. He's about 35 or something like that. And he was talking to us, etc. But after 35 days, he's just died.
Wow.
He's slightly obese. Just 2 days ago, we have put a 27-year-old on the ventilator. So this is a real problem.
Yeah. And Dr. Umesh, so let's take a 10-minute presentation from Dr. Umesh. We've got half an hour left on this webinar. So, Dr. Vinod, thank you. Can we have a big round of applause for Dr. Vinod, please? If you can put your emoji. This is like real guidance from real doctors with 30 years of experience in NHS in London. So let's move on to Dr. Umesh. Dr. Umesh, let's make sure your sound is okay, yeah, because we're having a small problem with the laptop. We're still struggling. I don't know what's happened, but we're really struggling with the sound.
Can you hear me now?
No, you're still a bit far.
Good afternoon. Can you hear me now?
A little bit, but you're far away.
I really no idea. Can you hear me now?
Perfect, perfect. Now it's perfect, yeah.
Okay, right. Good afternoon, ladies and gentlemen. I really want to thank everyone. It's a great pleasure to see 100 people joining. Let me first tell you this important meeting is about COVID first. I'll come to mental health, but as Vinod said, many of friends have died. I have lost 48 friends. And they are frontline workers, and they have sacrificed their life. So COVID is a real disease, and no one is safe until everyone is safe. And let me give you some statistics from UK. 30% of nurses want to leave the profession. 30% of nurses want to leave the profession. 40% of GPs want to leave the profession. That is how it has affected doctors and nurses. So doctors and nurses are human beings, and they need support. That is why even Mauritius has to make sure your doctors are supported. And no one is safe until everyone is safe. Now let me come to the mental health. Mental health is the most important health. In United Kingdom, 1 in 6 people have got mental health issues. When we talk about mental health, we are not talking about schizophrenia. We are talking about common conditions, stress, domestic abuse, alcoholism, and these. And when you have cancer, it affects your mental health. So mental health is the most important health for every one of us. But unfortunately, we do not talk about it. And particularly Asians, we are not good at talking about it. When we are depressed, when we are stressed, we don't talk about it. And that is the fundamental problem. And in UK, domestic abuse has increased by 600% since COVID. 600% domestic abuse. Child abuse has increased. Suicide has increased. And let me give you, even the doctors, 40 doctors have taken their own life, and 300 nurses have taken their own life in just last 10 years. So please remember, mental health is extremely important. I'm now going to give you some important statistics and how to be happy in life. That is what I want to focus. Number 1 is depression is extremely common, and it may be temporary depression, it may be permanent depression. And I know my own cousin took her own life. My niece took her own life in India. And that is the reason why if you don't talk to your own people, if you suffer within yourself, then you bottle it up. And that is the reason why young men suicide is very high. Young women suicide is very high. I know 3 GPs who took their own life after patient died. So there is a lot of victims when patient dies due to doctor's mistake. And United Kingdom, let me give you some statistics. 70 billion pound is spent on mental health. 70 billion pound is spent on mental health. 17.6 million days of income is lost. People don't go to work, so income is lost. 17.6 million days. And it is 12.7% of ill health in mental health in children. And let me give you statistics for children, very important. 10% of children have got mental health. 10% of children. And teenagers, they have got a lot of mental health problems. And that is the reason why mental health is extremely important. And when we talk about mental health, most important is depression, anxiety, neurosis, having a job, stress, and bullying causes. These are the reasons why mental health is.
Dr. Umesh, just a quick one. You talk about children having mental health. Now, a lot of parents are watching you right now on this platform. How come children has mental health? I mean, I've heard of it, but many may not have heard that children might have a mental health. Could you just elaborate a bit more on that, please?
Right. Important question, teenagers, absolutely teenagers. Number 1 is bulimia. Number 2, they have got anorexia nervosa. They become, and the main reason is they look at internet, they look at Facebook, they look at all models who are very thin. And that is the fundamental problem. And because of their weight, they get bullied. And they bottle it up. They don't talk to parents. Alcohol problem is increasing. Drug problem. I was shocked in India, Punjab. A lot of drugs are available now. And these are the reasons why. And unfortunately, human beings want to be rich quick. And that is the reason why they are under tremendous pressure by teenagers. And we put children under a lot of pressure for studies. And that is the reason why they are suffering a lot when they are teenagers. As a pediatrician, I've seen a lot of these problems. And I'm now going to tell you some of the simple things what you can do. Very important. Talk to people. Talk to your children. Make sure every day you spend 10 minutes with your children. Get to know them. Ask them how they are. Ask them about the question with any problems. And that is the only way you can. Happiness is the secret of success. You must be happy in yourself. And fortunately, Indian culture, we got family support. And in UK, they are isolated. I was shocked in UK. 1 million elderly people have no contact with human beings at all.
Wow.
1 million elderly people have no contact with human beings. And that is what causes depression. That is causes mental health problem. And my simple advice to you, talk about things with people. We got macho culture in doctors. Doctors are not good at asking help. Doctors are not good at looking after their own health. I had to look after, as a medical director, I had to see the patient, doctor with autism, doctor who had health problem, doctor who was addicted to drugs, and that is the problem I have to deal with. So my simple thing is, talk about your mental health, have a family support, some things, have some hobby, exercise, meditation, yoga, all of them are extremely good for mental health. And with coronavirus, with COVID, I'm expecting a lot of problems. In China, they had mental health increase. In UK, we are expecting mental health problems to be increased. And that is why we have to prepare for these things. Mauritius has to prepare for these things. And doctors themselves must realize they have to support each other. Otherwise, because imagine you are seeing your own friend dying in front of you. And Vinod told me about some of the doctors we knew. I lost a junior doctor who was a very good doctor. And he was only 45. He died in Berry. He was my junior doctor. And that is the reason why very important to support each other and guide each other. And family support is very important. I'm now happy to answer any question which any of you may have.
All right, so thank you very much. We've got about 25 minutes, 20 to 20 minutes left. If I can have Smruti and Dr. Vinod back to do the panel discussion. Smruti, take it away. And we can also have Dr. Vinod, please, for the panel session where I think Smruti has probably jotted down quite a lot of questions. So I don't know where Dr. Vinod is, but I'm sure he'll join us in a minute.
Yeah, I'm there, but you have to start my video. I can't.
Yeah, just 1 sec. Let me just go back to, I did stop, Dr. Right, let me ask you, ask to start video. Here we go. So you should be able to get back in now.
That's right. Yeah, I'm in the room.
Apologies for that. And we've got about 20 minutes. I believe it's going to be a great panel discussion. Smruti, take it away. Thank you very much indeed.
Okay. There is a common questions asked from everybody that if they've had a Covishield or any other injection on the first and second shot, and after a year they have to get the injection again, can they take a different injection or do they have to stick to the same injection? What are your views on this?
I would say right now the recommendation is that if you have taken the first dose, then you are supposed to say take the same vaccine second dose. Going in future, we don't know, because there is a trial going on in Liverpool where they're trying to mix and match. And if they find that trial, if they find some good results from that trial, in future we may get other guidelines about having a different kind of vaccine. But at this present point in time, if somebody has had Covishield vaccine 1, they should have the vaccine 2 as well.
Yeah. Another question which I've been asked by the panel is that a lot of people are asking me that if people are suffering from COVID, if they've had COVID, should they take the vaccination, or people should take the vaccination before they have COVID? And if they're in ICU or things, are they having COVID vaccines in the hospitals while they are suffering from COVID, or are they having afterwards? And the contraindications, like what you pointed out, if there's allergies and all these symptoms you pointed out in your presentation, Dr. Gadiyar. Can you just simply elaborate on that, please?
Yeah, if somebody has had COVID, for example, when can they take vaccine? That's your question, isn't it? So
Yeah.
if they have had COVID, and then they can take vaccine about 4 to 6 weeks after their COVID is finished with. But if they have had a severe infection of COVID, then we may have to wait a bit longer, say like 10 weeks or something like that. And whether to take COVID vaccine, if you are a hospital worker, yes, you have to take COVID vaccine if you are a hospital worker, because your chances of getting COVID is very high. So you need to protect yourself.
Yeah. So apart from in the presentation, you mentioned all the different long COVID, and you've discussed that at great length. So the bottom line is that everybody should take a COVID vaccine to immunize themselves at certain point. And those who haven't had COVID, they should still take the vaccine.
Absolutely correct.
Another question I've been asked that in developed countries, how come that more people are suffering from COVID? The COVID infection rate is very high, whereas in underdeveloped countries like India and developing countries, the COVID rate infection is low. What are your views on this?
To be honest with you, I really don't know why it is so, but I know why. Maybe because of the geographics. You know, if, for example, if you look at India, more than 50% of the population is under the age of 25. More than 65% of the population is under the age of 35. But if you look at other countries like UK or America, etc., in the Western world, lots and lots of people are at an older age. So this disease unfortunately affected older age people and killed them as well. Other thing is obesity. So obesity is more in the Western world. UK ranks number 4 in the world. And that is why I mentioned in my presentation that out of the 25 million people who have lost life, 22 million people, a majority of them, 22.5 million or so, are from those countries where the obesity is prevalent, which is more than 50% people are overweight or obese. That is BMI of 25 and above.
The next question I have is that in UK, the second time when we had the second lockdown, we had more cases of COVID and more people were dying. One person on the panel has asked in Mauritius, they are considering the second wave, this is their second wave. It's less virus than the first wave. What are your views on that? Do you think the first wave is less viral than the second wave, or all COVID viruses are viral anyway?
Nobody knows an answer to that question actually, but I would think that you know, when we had the first wave, end of first wave, we thought we will never have another wave, and we thought the second wave, if it is there in October last year, was going to be a smaller wave, but for some reason or other, that killed a lot more people and infected a lot more people. Now we are talking about a third wave here. So every country it is different, but for some fortunate reason, Eastern countries have been affected less than the Western countries, where they would be able to not cope as well. Yeah, Umesh, you wanted to say something?
Most important is obesity, and I think second is diabetes, and that's the reason why 10% of Asians got diabetes, only 2% Caucasians have got diabetes. So you have to look at all those things. And if you look at ethnic minority population, they're all different. Chinese, less obese people, so less death, whereas blacks, huge death in blacks, huge death. If you look at 75 nurses, Filipino nurses have died. Because number one, they are very close to patient. Number two, obesity. Number three, diabetes, ethnicity. And if you look at blacks, hypertension is a very important factor in blacks. Obesity is 40% in blacks. Bangladeshi women, I was surprised. A lot of them are obese. And that's the reason why India, only 5% population is obese. UK is a small country. And secondly, it's not about ethnicity or anything. Muslims, there are 5 to 7 people live in one house.
Yeah.
And we have discharged a lot of patients the first wave to the nursing home, and it spread like wildfire. So you are comparing apple with pear by comparing one country with other country, and that's the reason why.
And do you think this COVID is a biological war for the whole the world?
Absolutely not. I know it's easy to think that Chinese have planted something really terrible in the world, and we have all been affected, etc. If that were to be the case, it is a very, very sad thing. But I personally don't believe that is the right thing. But unfortunately, we got this disease, and it has affected lots and lots and lots of countries in the world, and economy is suffering, and there are lots and lots of effects to come in the future as well. You know, for example, the number of people who are unemployed in this country has gone up like anything. The GDP has plummeted in this country, so in many other countries. And also, so many countries have spent money like anything. So if China did this one to do such a thing against other countries in the world, I don't think it is right. But we are struggling, that's for sure.
Yeah, it's a very interesting question. I had to go and read this while we were on the call on this seminar. It's related to the consent form. In Mauritius, they've taken out something that when other people travel from UK or things like that, they have to sign a consent form of taking the vaccination. It was very interesting. I couldn't have time to dig into this. What is your views that if we come to Mauritius and we have to sign a consent form saying that about consent form that we are accepting that Mauritius doesn't take the responsibility that if anything goes wrong in the vaccine process in Mauritius. What are your views on this? This is what I think Mauritius has taken out. I just read briefly, and it was a very good question from one of the panelists, from one of the attendees. What are your views on this?
I think Youven would have answered some of this bit, Smruti, but if somebody is part of a clinical trial, yes, then they have to sign a consent because the clinical trial needs that. But once when the vaccine or in drug is out in the open or out to have for their disease, then there is no need for a consent form to be filled. But because the vaccine is quite safe, because it's been administered to millions and millions of people in the world, and there have hardly been any side effects. In fact, in the beginning, we were worried about side effects, like severe anaphylaxis was one of the contraindications here, and it has been removed now. And also, when we took the vaccine, I remember when I took my vaccine, I had to sit for 15 minutes in the building before I left the building. And even that is about December and January. Now that part has been taken out as well. So there is no need for anybody to wait even after having vaccine. So it is very, very safe. But I think every country has got their own guidelines, and they are using that one to safeguard themselves.
Somebody has also pointed out that they should not go and eat outside in a restaurant, and they should not eat meat food before taking the vaccine. What are your views on this?
Absolutely no need. Absolutely no need. There are so many myths. Absolutely no need.
People spread rumors and bad news and terrible things with ease. And unfortunately, our public are so gullible, they fall for it. There is no such thing as, I know if you are a diabetic, probably you need to eat something before you go for your vaccine, etc. That's simply because of the shock or whatever, people may become hypoglycemic, etc., etc. It's nothing to do with whether you should eat meat or not eat meat, etc. No.
Okay. The third question, one of the things is the trial of Sinopharm. What are your views on that? They're not proceeding with this sort of trial on Sinopharm. They're not releasing it. What are your views on this?
So sorry, Smruti, it was not very clear. What was the question?
Yeah, it is a question by Wade, who said the Sinopharm. It's something got to do with a particular type of things. Let me dig out the question again. But while I'm digging out the question again, can I ask you something? What do you think that in Mauritius, somebody has asked, it's my sister who's asked that, should children be vaccinated and when will they be vaccinated? For that, Shilpa, you should consent the Ministry of Health in Mauritius and how the vaccination process is taking place. In UK, it's different from Mauritius. So please get advice on the website of the Ministry of Health.
I like Smruti. I like this advice. I like this advice to Shilpa. You're telling her to go and seek advice in Mauritius. Fantastic. I love it.
Yeah. Okay. The last, not the least, it's Anil. Somebody asked the question of Wade. Wade had asked the question of Sinopharm. Why is the second test not coming out? So I just wanted to pick that question again.
What was the name, please?
It's Wade. Sinopharm has not been released yet.
Yeah. I think there are two Chinese vaccines. One of them is Sinopharm. Yeah, I think, I don't know, there are so many countries in the world producing different vaccines. And one thing is that whatever is available in your country, please take that vaccine. And all vaccines will provide you protection from severe disease, hospitalization, and death. So no matter what vaccine it is, so whatever vaccine is given to you or is made available to you, you got to take it. It doesn't matter.
Just to let you know, we've got 5 minutes left before I do a final conclusion. So 5 minutes left, Smruti, on your side.
Okay, I think most of the questions, general questions, have been addressed, but also I would like to point out a few things. I've had this discussion with Dr. Vinod Gadiyar and things like that. What I would advise you, that there is no vaccine which we are not allowed because of religious reasons, because of eating reasons, because we believe in something that there are ingredients there which prevents, suppose pork and beef for Indian. It's not that. Vaccines are safe, free, so please do not believe in the rumors and things like that. It's not important. Everybody should have the vaccine, protect themselves, and follow the guidelines given by your government and regulatory bodies in Mauritius. And the most important topic for me is also what Dr. Umesh said about mental health. And I think Anil touched that how can children have mental health? Of course, they can have mental health. A lot of Mauritians are in lockdown and their parents are teaching them in houses and they can't mix with their friends. They can't share the discussions. Everything when it's on internet, it's not always good. Some people in Mauritius cannot travel to go to universities and they're studying in Mauritius at the moment. So for children, it's very important that parents ask them from time to time, what are they suffering from? Because this is a very difficult period of time for them and it's not a usual thing. And relating to the stigma, I'll take an example of myself on mental health. I think I come from Mauritius. My parents and my family are very educated, but I've suffered from mental health severely as a professional. I'm a qualified person, and it was very difficult for me to explain to my parents who found it difficult to believe because from the generation from where we come from Mauritius, but it's not because I've stayed in UK that I had that. Anybody can suffer. So please take it seriously. It's not about when your family doesn't understand, you should still tell them it's important and you should talk about it. That's my view, and I strongly advise that this to be taken seriously in Mauritius. It's very, very important. Thank you a lot.
All right, thank you. And also, Smruti, you've said about maybe you talked about Dr. Youven, and 95 of us are still here, and you said maybe a mental health charity, which is probably primordial to have.
Absolutely, anything relating to mental health. I'm willing to help because I think Mauritius there's a stigma because we think when we say that we've got mental health problems, people think we have got psychiatric problems and we should visit a psychiatrist. I've been saying that before, and I strongly advise you that's not the case. Yeah, it's very relevant in this day and age. In Mauritius, even it's relevant, but people are scared to disclose about it. In the panel, somebody asked me that what are you doing for construction industry mental health? I'm sure that bullying and everything is very common in Mauritius with women and things like that. So my advice to you, Anil, in the construction industry, everybody should focus on this. Thank you so much.
Okay, Dr. Umesh, Dr. Vinod, do you want to answer this question? I think Vyas said, I had my first shot, but the doctors recommend not to have seafood in Mauritius.
I don't think that I love seafood as well, and I really don't think there is any contraindication to have seafood after having vaccine or before having vaccine, etc. There is no problem whatsoever. If Vyas is not having his seafood, he can send it across to me here.
Absolutely, Dr. Umesh. We can't hear you properly, Dr. Umesh. I think you need to get your laptop nearer to you.
Seafood, seafood, eat food, enjoy food. These are all myths. My only final point is we have not seen the last of COVID. COVID will be with us for next 10 years. And the worst impact we are yet to see, unemployment, a lot of other problems we are yet to see, mental health and everything. That is what I think is going to be with us for the next few years. We have to prepare. There is no fun in getting scared about it. We have to prepare. We have to live with it. We have to respect it. That is what my final point.
We take the last question from the participant before I conclude. There's a participant called Silas. I had asked this question from a medical point of view. What do you think is the reason why the third trial of Sinopharm has not been released yet? Like, why do we have less and less information from China concerning their vaccine? Maybe Dr. Umesh, and then before I move to Dr. Vinod.
I have a personal feeling China is a very secretive society. China is a very secretive society, and that is the fundamental problem with China. And that is the reason why we don't know a lot of things, and they have not allowed WHO to inspect what has actually gone on. And that is the tragedy in all these things.
Okay, and Dr. Vinod?
Yes, I completely agree with Umesh. China has got a very, very, very secretive approach to everything, not just COVID. They may or may not have got some data which are likable by other people. So that may be the reason why they are hiding it. So this is what I think, but I don't know any more than this. Thank you.
Okay, I'm going to get back to you for final words. I'm now going to try to conclude with a few slides. But before that, I've got a last poll survey, and that's a good one, actually. So the poll survey is, would you like more informative webinar on COVID-19 similar to this one in the future? I mean, we've got 2 hours of free advice from, true expert, I'll say. Thanks to Smruti, but I think that's really, really good, where we're getting structured, disciplined advice from experts all over around the world. So I think I'd just like to say, would you like more information on webinar on COVID-19 to this one in the future? Already 90% of you have voted, and I'm just going to end polling now. What do you think, Smruti? I mean, you've done that now. What do you think would be the participant thinking of?
I think it's 100%, definitely.
100%. Dr. Umesh and Dr. Vinod?
80 to 90%.
I think about 90%.
Okay, let me share the result with you. And the result goes out to 100%. They want more webinars from you guys in terms of medical health. Look, I'm a construction guys. I don't want to get into this medical profession, but if we can help more people out in terms of COVID-19, mental health, definitely bring it on. So can we have a big round of applause for all the Smruti from the UK, Dr. Umesh from the UK, and Dr. Vinod as well from the UK. Thank you very much indeed. So quickly, I'm just gonna, I'm just gonna stop there. So thank you everyone for the 100%. And I'm not just gonna now conclude with a few slides, so bear with me. We've got 3 or 4 minutes to go, and I'm just gonna share my slide with you. So if you can switch off your video as well, not a problem. And for a quick breather before I finally finish. So I'm just gonna show you this quickly. And I think I'd like to give you a tribute. Just one sec, we are correct slide. There we go. So before we conclude, I'd like to say a big thank you to everyone, including the doctors in the community today, for all the key workers. I think it's a tribute. So I'm just going to show you a quick video before we conclude. So I'm just making sure we've got that right, and we've got the sound as well. Fantastic. And off we go. So if you can hear the sound and also the screen, please put your hands up. Off I go.
You're the engine that makes all things go, and you're always in disguise, my hero. I see your light in the dark, smile on my face when we all know it's hard. There's no way to ever pay you back. Bless your heart, know I love you for that. Honest and selfless, I don't know if this helps it, but good job, you're doing a good job, a good job. You're doing a good job, don't get too down. The world needs you now. Know that you matter, 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 yeah. You're doing a good job, a good job. You're doing a good job, don't get too down. The world needs you now. Know that you matter, 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 yeah.
6 in the morning, as soon as you walk through that door, everyone needs you again. The world's out of order. It's not a sound when you're not around.
All day on your feet, hard to keep that energy. I know when it feels like the end of the road, you don't let go, you just press forward. You're the engine that makes all things go, go. Always in disguise, my hero. I see a light in the dark, smile in my face when we all know it's hard. There's no way to ever pay you back. Bless your heart, oh I love you for that. Honest and selfless, I don't know if this helps it, but
good job, you're doing a good job, a good job.
good job.
You're doing a good job, don't get too down. The world needs you now. Know that you matter, matter, matter.
Good job. You're doing a good job, a good job. Yeah. You're doing a good job, don't get too down. The world needs you now. Know that you matter, matter, matter. Yeah. The mothers, the fathers, the teachers that reach us, strangers to friends that show up in the end. From the bottom to the top, the listeners that hear us, this is for you. You make me feel it. You're doing a good job, a good job. Oh, you're doing a good job, don't get too down. The world needs you now. Know that you matter.
Thank you so much to our first responders, our healthcare workers, our mothers.
Thank you to our moms and our dads. Thank you to our teachers who've helped us.
We know it's been hard, but thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you. Good job.
All right, so thank you. I know it's very emotional, everyone. Big round of applause to all the key workers and doctors out there. Thank you very much indeed. And before I conclude and get back the panel, I'm going to share this book with you. It's called Brace for Impact, Surviving and Thriving in the Pandemic Era. And the book is really, really good and talks about for times such as these two great authors have collaborated to deliver us an incredibly useful book. Alexandra and Dr. Amy are experts in the field of well-being, physical and mental strength. And I'm so thankful they have turned the genius to the complexity we're all facing right now. This book will help us all to take a breath, get some clarity, and develop some resilience. Brilliant. And then finally on this book again, the feedback. This is a must read for anyone that not only wants to survive isolation, but emerge from this unique situation a better version of themselves, both physically and mentally. So if I want to just, if I can have your the videos, please, all the speakers. If I can have your videos back as we conclude the webinar on a 2-hour session. So just make sure you've got a video. Thank you much indeed. So to all the speakers, it's Smruti. I'm extremely impressed by your kindness, energy, sheer willingness, great determination to keep sharing your experiences, wisdom, knowledge, and for being a role model. And also from the bottom of my heart and all the participants today, thank you for giving back. So take care, everyone. Be safe. And I'm just going to go back to have the final word from starting with Smruti. How did you feel about the whole webinar and your thought, please, before we finally conclude?
I think Anil, thank you so much for organizing this. I'm chuffed. And it's very great for me to help my fellow Mauritian friends out there who are suffering in this pandemic and this lockdown. Stay safe, wash your hands, wear the mask, look after your mental health, and please, given the opportunity, please take all the vaccinations. There is no such thing. It's no harm to any religion and to any humanity. It will only protect the humanity. Thank you so much.
Thank you. I also like to thank my colleague Davison, who's been moderating behind the scene all the time. So Davison, thank you very much indeed for all your help as well. Before I move to Dr. Umesh and Dr. Vinod, please send me an email with your feedback as well as your name for the certificate attendance, which we normally issue as part of the webinar. This is my 45th webinar today, and I'd like to thank everyone for this, for all your participants and love for making my 45th webinar today. Moving on to Dr. Vinod, your final word. I'm sure we'll see you back probably in 6 months' time or a year. What's your final thought to us in Mauritius and your advice to all of us here in Mauritius and also people watching in African countries, South Africa, Rwanda as well?
I would like to say thank you very much, Anil and Smruti, for giving me an opportunity to talk to you and share my experiences. And if this helps even one individual to take their, to take vaccine on and prevent disease, etc., I have done my job. COVID is a real disease. It is not a myth. And it is a disease that can easily kill you. So don't take it lightly. And if you ever suspect, get a test done and self-isolate and make sure that you don't spread it to others. And once you are given an opportunity to have any vaccine, please take it, never hesitate. And also tell others that vaccine is safe and never believe anything from a source that is not reputable. Talk to doctors, talk to experts, and make a decision for you and your family. And look after yourself. Thank you.
Thank you. Dr. Umesh, final word of wisdom to us in Mauritius and in countries in Africa.
Can you hear me?
Yeah, we can hear you.
Right. Can you hear me now? Yeah. I just want to say I've done many webinars. This has been the fantastic one. Number 2, I visited with Vinod, Mauritius and South Africa. You got a fantastic country. It was a great pleasure to visit you all, and I really enjoyed it. Finally, I would like to finish with Mahatma Gandhi's famous quote. He said, "Don't lose faith in humanity. Humanity is an ocean. Few dirty drops do not make ocean dirty. And humanity will come stronger from this COVID, and world will be a better place for all of us. Stay strong and help each other, support each other, and a world will come out of this COVID, and it will take a long time, but humanity will be a lot better when we come out of this world. If COVID doesn't make us better human beings, nothing will make us better human beings." And I really enjoyed presentation. I really enjoyed your spirit, and it's a great pleasure to meet all of you. And from the bottom of my heart, I want to thank you all.
All right, thank you very much indeed. Look, we can't thank you enough. Like I said, we are humble, honored to have Smruti, Dr. Vinod and Dr. Umesh. You know, without Smruti, it would never have happened to get you doctors with 30 years of NHS experience in the UK, plus Dr. Youven as well, who is one of the rising stars in Mauritius. So guys, thank you very much indeed. I want to talk for the next 2 hours with you, but obviously we have to stop at some end. So everybody, can we have a big emoji, a big round of applause, everyone, for making this happen. So thank you very much indeed, everyone. Take care, everyone, where you go. Be safe and look after yourself until we see you next time. Thank you very much indeed. Bye.
Bye. Bye.